Rebecca. I'm a level 1 nursing student. I think I have your patient today.
Okay.
Could you give me an SBAR report?
So you have Ronald Jarvis?
Yeah.
Okay. He is going to be in room 622. He's a 67-year-old male. He has no known allergies. He is a full code. He has been a diabetic for 20 years. His doctor is Kay Phillips. And he was brought in, he drove himself here from his physician's office because he has a stage 2 diabetic ulcer on his right heel. He was also diagnosed with hyperglycemia when he was admitted. He had some pain when he came in. It was a 6 out of 10, and we administered some morphine, and that brought his pain level down to a 1. So we got that cleared up when he came in, and right now we assessed him, and he has a level of consciousness of alert and oriented times 3. He wears glasses. He has no cranial nerve problems. He has full range of motion and moves independently. He may need some help walking occasionally, so if he calls, maybe you can help him with that, or if you need some help, you can call for help and we can assist you.
Okay.
He has clear auscultations. His pattern is even and effortless. His pulse ox is a 95%. And his heart sounds are regular. His apical pulse is regular. His pulses in his extremities are as expected. They are symmetrical, and they are a +2. His heart rate is an 80. His blood pressure is 145/75. Cap refill is less than 3 seconds. His bowel sounds are active in all 4 quadrants. His abdomen is flat to palpitate. And he is a diabetic, so be aware that he is on a specific diet for that. It is a 1,800 calorie intake and a 2-gram sodium restriction.
Okay.
He voids by himself. His last void was 320 mL. And he has a yellow straw-colored urine, and he does have an IV site on his right forearm, and that was checked. There's no problems with that, and there's no inflammation. That was just put in. He is a fall risk, so we need to be aware of that. So we need to keep an eye on him. He does need to have his wound changed twice a day. So once in the morning, once in the evening. We need to be doing AccuChecks before meals. And we need to be repositioning him every 2 hours because of he's a diabetic and he's susceptible to get wounds, and he already has one.
Okay.
Yep, so, and then he does need his nighttime dose of insulin if you want to come watch.
Okay, yeah. Can I ask you some questions about the insulin?
Yeah.
Why specifically is the client receiving this medication?
So this client is a type 1 diabetic, and because of that, his pancreas does not produce any insulin. So he is an insulin-dependent client, and we need to administer insulin.
Okay. What action does the medication have on the body?
So it is going to facilitate the uptake of glucose in the fat and muscle tissue by inhibiting production of glucose in the liver.
Okay. When should you question administering this medication?
So you're going to question administering this medication if the client, if their AccuCheck is maybe too high or really too low. You're going to want to notify the doctor and hold the insulin. His Accu-Check was a 242, so we are going to administer this insulin, okay?
Okay. Does the medication have a therapeutic serum level?
No, it doesn't.
Which vital signs must be monitored?
So you're going to monitor his Accu-Check, which we did. You're going to continue to monitor his blood glucose. If it drops, because there is something called the pre-dawn and Smogy phenomenon, which may happen if we're giving the bedtime dose. So we need to keep an eye on that, and we'll monitor that. And we're going to check the hemoglobin A1C and monitor that.
Okay. Which physiological parameters should be monitored when the medication is being administered?
Okay, so before we administer the medication, we're going to check the site and the area that we've been administering it. We're going to check for any redness, heat, swelling, any lipodystrophy, anything that might be out of the ordinary when you're observing it. And you're going to want to check for any anaphylactic reactions, things like that.
Okay. What interventions must be taught to the client to ensure that the medication is administered safely in the hospital setting?
So we're going to want to teach the client to be eating their bedtime snacks. We're going to keep some bedtime snacks by their bedside in case they're having a hypoglycemic event. In that case, then they can reach over and grab a snack and eat it. And we're going to want to make sure that they know where their call light is and what some of the signs or symptoms of hypoglycemia or hyperglycemia are, so that they can just call for us if they need help, because it's an emergency.
What interventions must be taught for taking the medication safely at home?
So at home, you're going to want to make sure they know how to draw up the insulin themselves. You want them to know how to dispose of their needles, how to store their medication, to check for their expiration date, things like that.
Okay. What are the side effects and potential adverse reactions?
So some side effects or adverse reactions are anaphylaxis. So if they are short of breath, they can't breathe, they are having like an allergic reaction like that. That is a adverse reaction. If they're having like a side effect like around the area that you administer the medication that we talked about earlier, any of those, or if they're having a hyper or hypoglycemic event.
Okay. And just one more. How would you know the medication is effective?
So you're going to know it's effective if their blood glucose is lowered, if they have a therapeutic level. So we're going to want it to be maybe below 120.
Okay.
Okay. Any more questions?
That's it for now.
Okay. So we're going to go into the MARM and check what the medication, the order. So he is going to be we're going to be administering Glargine Lantus for this patient, 18 units, subcutaneous, at bedtime, 2200. So that is the right time. We're going to go to the anti-diabetics. We're going to grab it and check. We have Glargine Lantus, and the expiration date is 7/2017. That's good. 18 units, which we're going to draw up subcutaneously at bedtime. That's the right time. And it is the right patient. This is Ronald Jarvis. And this is his room. So we can go in. And then we'll draw that up while we're in there, okay?
Okay.
Knock, knock. Hi. Hello. How are you? I'm good. So we're going to be administering your bedtime dose doctor has ordered for you. Are you used to taking this medication?
Yes, I am.
Can you maybe tell me what this medication is for?
For my diabetes?
Yeah, and then do you know why you're taking it at nighttime?
No.
Okay, so you're taking this dose at nighttime because it's going to act as normal bodies would and produce insulin for you to lower your blood glucose, your blood sugar at nighttime. Okay, so you're not going to be high while you're sleeping.
Okay.
You're having hyperglycemic event. Okay?
Okay.
Do you have any questions?
No.
Do you know what some of the signs and symptoms are of hypo and hyperglycemia?
Sometimes I get lightheaded.
Okay. Is that how you normally feel when you're having a hyper or hypoglycemic event? Okay, so if you feel shaky too, or if you start sweating a lot, then you're going to want to call us. Or if
Okay.
your breath is smelling fruity, those are some major signs, okay?
Okay.
All right. So we're going to want to get an alcohol swab. And we're going to just put it on here. And while that's on there, so I'm putting that on there so that in case there's anything gross on there, that like any germs will be killed.
Okay.
Can you tell me your name and date of birth?
Ronald Jarvis. 1/8/48.
Okay, and then do you have any allergies?
No.
Okay, that's correct. So it says in here Ronald Jarvis, and he's supposed to be getting insulin, which is the Glargine Lantus, which is what we have. Okay, so we're going to want to draw up 18 units of air. You're going to inject the 18 units of air. And then you're just going to draw up 18 units. If there's any air bubbles, you're going to want to get those out. You're going to recap your needle with one hand. And once that's on, you can just pull it down. And then you're going to want to have another nurse or a student nurse. You're going to, can you just tell me how many units that is?
Looks like 17, 18. 18, sorry.
18 units, so you want to make sure that you have the right amount because of safety problems, safety issues. So after that's done, we're going to check again. But we're going to scan the patient, scan the medication. Scan the patient. So we have the right patient ID and the medication. We have the right medication, so it's verified, it's green. Where would you like your insulin administered?
My abdomen.
Okay. Is there a specific spot that you got it last time?
I got it on the right side last time.
Okay, we'll put it on the left side then. And you're gonna let that dry. After that's dried, you're gonna wanna pinch. Go in at a 90-degree angle. Let it sit there for a second, take it out. And this is gonna go in the sharps container. Are you okay?
Yep.
Okay. Is there anything I can do for you?
No, I'm good.
Okay. So, I brought you a teaching pamphlet in case you had any more questions about the medication.
Thank you.
If you want to look over that, and then you can just write down any questions that you have, and I'll answer them when I come back. There's nothing else I can get for you now?
I'm good.
Okay. I left some snacks by your bed as well, and you have your call light next to you? Okay.
Thank you.
Welcome. So we're gonna want a chart. Do you want to see the charting?
Sure.
Okay. So you're gonna want to do the time that you administered the medication and how many units, things like that. You're also gonna want to do the teaching in there. Okay? Is there any questions that you have?
I have a few more. Was there any pertinent pieces of information that you reviewed before you administered the medication?
Okay. Yes. We actually reviewed beforehand what his AccuCheck was, what his blood sugar was, and because it was 242, we administered the medication. And if it were lower or higher, we might have not. So you always want to check that.
Okay, thanks.
Okay. Thank you.
Thank you.